Year is given to individuals who have dedicated their lives to bringing clients dignity, respect, choice, care, and lives free from stigma and prejudice. A Behavioral Health Person of the Year can be a professional, a client, or even a family member. They must also be a community leader and a selfless advocate. I know we have some past recipients of this award here, so please stand so we can acknowledge and applaud you. Here to present the 2018 Behavioral Health Person of the Year is last year's winner, Dan Melcher.
Thank you very much. It's wonderful to be back. I got to tell you, I was just asking them, and they said that they're ahead of schedule tonight. For the first time in years? 32 years. Until I got it there. Just kidding. One of the great things about this event is how it recognizes so many pieces of the huge behavioral health umbrella. And that's no more correct than tonight when it's being honoring somebody who is involved with providing children's services. I can't remember actually the last time that that was the case, and so it's about time that we recognize somebody who helps the kids. Anybody who, like us, who works with children knows that it's a special and a unique type of person to work with. There are challenges that don't exist in the adult world. There are rewards that don't exist in the adult world. So it is a very different and exciting place to be. And nobody knows that better than Walter Phillips. Walter has been the CEO of San Diego Youth Services for the last 18 years. Helps over 10,000 people every year. You know, huge variety of services. If you read in the program, you'll see, and you'll kind of wonder, well, what's wrong with me when you read about all the stuff that he's doing. I mean, listen to this list: mental health, substance treatment, foster care, independent living, homeless outreach, shelter, drop-in center, adoption, and protecting runaway, abused, and exploited children. And that's just a summary of all the things that they do. Now, one of the reasons I'm here, in addition to introducing Walter, is that it's my responsibility to explain to him kind of what this award is all about and what it means. And so I've already done that, but I'm just going to want to reiterate a couple of things. The first thing I made sure that he understood is that this doesn't come with any kind of golden ticket. He's not going to get the best table at every restaurant from here on out. Not going to get to sit in the front row of the theater. Not going to be upgraded to first class when he flies. And above everything else, Walter, when you leave here tonight and you're feeling really good, do not go home, say, I'm going to put on the 11 o'clock news and I'm going to see myself on the news. Not going to happen. There'll probably be a story on the news about some kid who found a potato chip that looks like the Pope. But they won't have Walter on the news. Now, but I would say this. Everybody in this room knows that what we do is not easy. And there are certain things that help to make it easier, however. We're always running into roadblocks, one-way streets, potholes, whatever. But when we get recognition from our peers, that really helps. When we get appreciation from our peers, that even helps more. And when we're honored by our peers, it helps even more. So maybe when you get down to think about it, maybe there really is a golden ticket with this award. The 2018 Behavioral Health Person of the Year is Walter Phillips.
I thought that they had it wrong, that Jim Calhoun was getting the Behavioral Health Person of the Year. Gail, I think you said I had till 9 o'clock, so get comfortable in your seats. But seriously, when I was walking here and I looked around the room and I saw so many people that I've worked with over the 3 decades that I've worked in the field. I've been a social worker. And that is the 32nd anniversary of our awards. Well, I became a social worker here in the community working in mental health 33 years ago. So when I was thinking about what I should talk about, what I should say, there was so much I could talk about. I wasn't sure what to say tonight. Should I talk about when, in my early career, in the late 80s, there was very little funding for children's mental health, and Alfredo probably could talk about that. You know, in San Diego, limited funding, but back then we got some specialized funding. It's called AB 3632 at a time, that provided specialty mental health services for children. It was one of the first dedicated funding for children's services. Or should I talk about when I worked at UPAC with Vietnamese and Laos? There's UPAC over there, my peeps. Early in my career, where we worked with refugees from the Vietnam War. And back then, PTSD was not an allowable, billable diagnosis. We've come a long way since those days. Should I talk about some of the partnerships that I've worked with? And Barrett Miner's got an award now. Where's Barrett? Barrett and I, there you are. From Children's Hospital. Barrett should be up here. It's been 40 years with Children's Hospital. Barrett and I started one of the first school-based mental health services for children way back in the 90s. So should I talk about that? Or should I talk about when we brought managed care to San Diego, and United Behavioral Health came in and the county gave everything to UBH, and I was part of that team that helped start that up and run the provider services department. And by the way, the county did not give us enough money. Is anybody that's a provider surprised by that? Or should I talk about those early days with Piedad Garcia and our, at the time, it was the Minority Affairs Work Group, and then the Ethnic Diversity Resource Team, then the Cultural Competency Resource Team, where cultural competence standards was not really something that we thought about, and so we were trying to put those together. And that was part of my career as well. Should we talk about that? Or should I talk about when mental health system? I've been around, so Barrett was saying, you've worked for everybody here in San Diego. We just started the mental health and the division model, and I was in charge of the mental health division for a mental health system. I didn't realize that I would be traveling out to Needles, California to oversee programs out there as well. Or should I talk about where I am now, San Diego Youth Services? And I do have to say there were some sneaky people that really helped get me nominated for. Stephen Gillet in the back there, and Marianne Whittemire. Where's Marianne? I think she was very behind the scenes as well. And it really has come full circle because Marianne's late husband, John, founded San Diego Youth Services in 1970, and here I am standing on the stage to recognize them. That's all about me, and tonight's award is really about who we help, and the clients, and the youth, and the families, and those who have benefited from the services, those who are still benefiting from the services. So I wanted to share a story about Danny, who, I met Danny in the late 80s, and Danny was 17 with a promising career. He's a baseball player in high school. They were really gearing him toward a professional career. Handsome young man. He was the star of the school, straight A student, and at 17, Danny had his first break. And he came into our residential treatment program, and the family was just devastated. And so, worked with Danny for about a year before he transitioned into the adult system. Well, many years down, fast forward, and it was about a couple years ago, Danny's family ran a shop here in town, and I was down near the shop. I thought, I'll pop in and see, you know, if the family is still there. And I walk in, and there's nobody else in the shop. It's a late night, and my wife Heidi was with me, I think. Where's Heidi down here? And guess who was working behind the counter? It was Danny. And Danny remembered me, and I remembered Danny. And it was because of that human connection that we had made so many years before. And Danny wasn't a baseball player, pro baseball player. He wasn't an entrepreneur. He wasn't successful in those ways. But Danny found a new normal. And he found that new normal because of the great help that he received by the system, by the people in this room and people like in this room who provided the care and the support and helped Danny realize that his life was okay. He just had a new normal. And there was Danny. He was 40 years old at the time, and I had worked with him when he was 17. It just told me how old I was. And that's what it was all about. That's what tonight is all about. It's really about recognizing the people that are really the people who have the most courage, or those who are coming forward and seeking the help, and that are there, that we help day in and day out. So I wanted to acknowledge all of those of you who are the consumers, the clients, those of you with lived experience. Please give yourselves an hand. So I'll end by just thanking a few people. My family is here. My son drove down from Los Angeles in the middle of finals. I don't know what you're doing here. I'm sure my mother here, who's responsible for me being here. I wouldn't be here without my mother. She came down from Los Angeles as well. My wife Heidi, who's been a mental health professional for over 30 years, working with very difficult populations. So thank you, Heidi, for being by my side. Some of my best friends in the world are back here. Our board, we have a board member, Patty, and her board, representing our board. But most of all, I want the San Diego Youth Services team to stand up. Please stand up back here. We've got the team. This award is really for you because you're the heroes that are day in and day out doing the work, and I have the privilege of being your leader, and it's a great honor. So thank you very much. Thank you for recognizing children in our system and youth. If we can intervene now, we can make a huge difference in people's lives. So thank you to the committee and to all those anonymous judges who voted for me. So thank you, and thanks to all of you who are so deserving, and I hope that that we continue the fight. Thank you.